Okay, so we're going to move on to our next session now, which is going to talk about patient-centered pledging in action and 19,000 patients feedback for NHS Change Day. So we've got two speakers for this session, Rachel Royall and Ben Tawfik. I hope I pronounced that correctly. And I hope you're all set up there and you've got your videos and your mics going. So really, Rachel is going to talk about her test work with pledging at Epsom and St. Helier, which launched a patient first program. And then we'll be having Ben talk about Hospedia's pledging, what some of their actions and outcomes were. We're kind of run this in the same kind of format as we did earlier. So we'll get Rachel to go first with her presentation, then followed by Ben, and then we'll have a question and answer period at the end. But if you have any questions as we're going through, please feel free to just put them into the chat box. Okay, can I have the next slide, please? So Rachel, we've got your slides up there now. Just let us know when you want us to progress to the next slide. So go ahead.
Okay, great. Thank you. Can you hear me okay?
Yeah, we can hear you loud and clear.
Brilliant. Good morning, everyone. My name is Rachel Royall, and I'm the Director of Communications and Corporate Affairs at Epsom and St. Helier. What I thought I'd do today is tell you a little bit about the journey that we've been on as a trust in recent months that's led to many of our staff making patient pledges and what has resulted in a full-scale programme across the trust to drive real sustainable improvements that put the patient first. Next slide, please. As we all know, the Francis report was published in February last year, and it made a number of recommendations that were relevant to us as an acute trust. We reviewed all of these recommendations, from compassionate care, the duty of candour, the role of the Care Quality Commission, our relationship with our local health watch organisations, and in particular the role of staff and how they raise concerns, identify issues, and all different things that are important to patients and how they solve problems. From that work, we developed 4 work streams. Next slide, please. The first one was around organisation development. The second, patient experience and complaints. The third was risk and quality assurance. And the fourth was around effective ward care. But really, we knew that to try and improve the culture and to understand the concerns of our staff and patients, it wasn't just about the work streams or the programmes. We really needed to listen to our staff and engage them in some honest and open conversations. Next slide. So starting in the summer of last year across our hospitals, we embarked on a number of listening events with our staff in clinical and non-clinical areas. And we asked 3 core questions. Would you recommend your service and the trust to your friends and family? If you have a concern, do you think you could raise it, and would your manager do anything about it? What one thing could you do to improve the care that we give our patients? Next slide, please. There were many key themes, from staffing levels, incident reporting, effective ward rounds, and dignity. Next slide, please. However, it was from the last question, what one thing could you do to improve the care that we give our patients, that the idea of our My Patient Pledge campaign was born. And it was built on the premise that sometimes change can be difficult, scary, cumbersome, daunting, and there were lots of really big things that people were a bit afraid to change. But one of our members of staff said, wouldn't it be great if we all made one small pledge and one small action? Because if we all took one small action, we can really affect change and improve the care of our patients and make some big improvements. So from around September, we developed our pledge cards in-house and launched them at an event with our executive team. Across our organisation, all staff, from porters, directors, doctors and nurses, started to make their pledges. Our local MPs also joined in too, from Conservative, Labour and Lib Dems. We got them all to make patient pledges. On March the 3rd, we joined in with a national event with pledge polling stations in our restaurants, encouraging more staff to pledge, and the pledge board went on tour at team meetings across the organisation. The nursery, pharmacy, elective orthopaedic centre, for example, all developed their own boards and are displaying their pledges where they can be seen by their staff and visitors. Next slide, please. As part of the journey, though, it wasn't just an internal exercise. Using the power of social media and the hashtag #MyPatientPledge and joining in with the national NHS Change Day campaign, we shared our pledges far and wide. And throughout March, we shared them with our patients and their families at listening events that we held in partnership with our local Health Watch organisations. However, for us, it was important that the pledges and the actions we take are sustained, and almost perhaps a little more by accident than design. We had also been developing a Patient First programme, and apologies, my slides are probably a little bit in the wrong order. So next slide, please. Go to the next one, please. So we developed the Patient First programme, led by Cherry McCormack and our People and Organisation Director, Kevin Croft. And it was a programme of 4 sessions that really helped to embed the change and help our teams to make individual pledges and pledges as a team. It was very much focused on what can I do, what can the team do, and what other help do we need. And we're really beginning to see and unblock some of the problems and make some improvements. Essentially, the programme is 4 sessions, and we encourage mixed teams from across all of our hospitals to attend, everyone again from doctors, porters, nurses and corporate services, and we're really keen that at the sessions there is a mix of different staff. So the 4 sessions are really well designed, and they're based on real patient information from the Trust, the real complaints that we get through our own patient survey data. The first session looks at the history of the NHS, what's changed and the challenges and opportunities, and this helps us to set things in a broader context. The second session is quite interactive and takes a lot of our data from complaints, the inpatient survey, and gets the teams to look at different patient journeys and explore what some of the issues are. The third session is a walk around as a team, and we send the teams off around the hospitals with a clipboard and pen, looking at things from the patient perspective. The fourth session is where we've really combined this with the patient pledge campaigns, and as the teams come back and make their action plans, they link and make their pledges. To launch the campaign, we started to look at innovative ways that we could see things from the patient perspective. So, sorry, go back a slide, please. So we put Sue Cook. Sue is a wonderful older people's nurse that works at Epsom Hospital. So to launch the programme, what we did is we put Sue in an older people's suit, an age suit that we have, that gives her the feeling of lack of mobility in her joints, and really we sent her walking around the hospital to see things completely from the patient's perspective, reading the letters, how to get up the stairs, pouring a drink of water. And even from that, we've been able to find problems that we didn't know we had. For example, patients find it really difficult to pour water. So we're going to look at getting easy to use drinking jugs, really, really simple things. So what's next? This morning I've just come away from our Patient First steering group, and we've appointed a programme director for the Patient First programme, and this group's going to oversee the rollout of the training programme across the Trust and the sessions that we're running with staff to help them understand the patient journey. And we're starting to ensure we really maintain momentum and pick things up, not just the individual actions, the actions as teams, but also there's things trust-wide that people have kind of battled with and got frustrated with at a local level. And one of those things is something around signage for us as a trust. Our patients and our staff constantly frustrated around signage, so it's really helping us to solve some real problems. That's it. Thank you.
Thank you very much, Rachel. So we're going to move on now to our next speaker, which is Ben, and then we'll have questions coming in at the end. Okay, go ahead, Ben.
Hi, good morning, everyone. Can everyone hear me well?
Yeah, we can hear you.
Fantastic. So I'm very pleased to be sharing the Hospidia pledge towards NHS Change Day with you. And it's probably a good starting point to introduce it to you. If you could go to the next slide, please. So when Hospidia learnt about the NHS Change Day, we were pleased to come up with a pledge, which is Hospidia to promote the NHS Change Day to patients at their bedside, to inspire patients to make pledges and to gain feedback from all patients on where they think improvements will make a real impact to the NHS. And to put that into perspective and why Hospedia feels that it can contribute to that, if you could go to the next slide, please. At a very high level, Hospedia is the world's leading operator of healthcare systems at the point of care. So Hospedia has presence across 155 NHS hospital sites with approximately 70,000 bedside units that act as entertainment systems, but also patient engagement platform and a provider for clinical access for clinicians and staff members within the NHS. So to fulfill that pledge, if you could go to the next slide, please. Hospedia constructed a nationwide campaign on its bedside units, utilising its advertising and promotional platform, as well as its patient feedback capabilities at the bedside. And what that meant is, in cooperation with NHS IQ, the content and the images were agreed on what to promote at the bedside. So advertising would appear on all bedside units to raise awareness of the NHS Change Day, but also it has the ability for the patient to click through and go to the NHS Change Day website for patients and their visitors to learn more about it, but also to give them the ability to submit a pledge and to be more educated about the whole initiative. So that was one component of the campaign. The other component was enabling the real-time patient feedback system at the bedside to ask patients some key questions about their satisfaction or their vision on whether the NHS Change Day would have any impact, with general satisfaction questionnaire to assess their opinion about all the services provided to them during their care in hospital. So if you could go to the next slide, please. So the campaign ran 3 days before the NHS Change Day, which was on, I believe it was the 3rd or the 4th of March, and included the day itself. So it spanned over 4 days in total. It generated 7,600 click-throughs from patients and their visitors to the NHS Change Day pledge website, which clearly enabled them to navigate through the portal and make decisions on whether to submit a pledge or not. Also, the on-screen surveys generated a staggering over 19,000 responses in total over 4 days, with really valuable feedback on various aspects that was addressed to them. Next slide, please. So from the advertising component of the campaign, again, a very, very high level, the top 20 sites, hospital sites, that have contributed to that 7,600 click-throughs come from the list that you can see there, ranging from Adam Brooks to, all over the country, basically, which is very interesting. Next slide, please. So some key findings from the patient feedback that was addressed through the surveys at the bedside over the 4 days. Several questions were raised, all agreed by NHS IQ. Some of the very, very interesting feedback is 78% of patients think NHS Change Day will make an impact on patient experience. So that was really positive feedback about the whole activities regarding the NHS Change Day. 65% of patients choose to say thank you to nurses, doctors and healthcare assistants while they're in hospital. And then we'll go through a bit more detail on what it compares to. 49% of patients think NHS needs to make improvements in the way patients are treated and communicated to. So these two are the top two factors for patients in terms of improvement they expect from the NHS. 50% of people think that by keeping their scheduled appointments and going to A&E only in emergency situations will help improve the NHS. And frontline staff are most trusted by patients to improve the future of the NHS. So really interesting statistics there. All the data was fed back to NHS IQ to derive more conclusions from. The next slide, please. So the next couple of slides kind of go into the detail of the findings, highlighting the top 10 hospitals or contributors to this information.
Hi, everyone. Sorry, it looks like we just lost Ben's audio. Sorry, these things happen. Technical issue happens on the WebEx. So I'm just going to see if we can get her back connected. So if you just bear with me for a minute or so, we'll see if we can get her back online. In the meantime, I'm just looking in the chat box, and Andy, who was a presenter in the session just before the session, has said that we can Google the poem that he read out, and I think he's sent something else in there. There's another story on YouTube that he recommends people watch. Does anyone have any questions for Rachel as we're waiting for Ben to come back in? If you just raise your hand. Nope, doesn't look like anyone has any. Rachel, I have a question for you. There, oh yeah, just seen you go off mute. So Ben's back, but okay, I'm going to stop asking my question and wait till the end because it looks like Ben's back on the line. Ben, are you there?
Yeah, I'm really sorry about that. I just got disconnected. So
no problem at all.
Shall I just carry on with the last two to three slides?
Yeah, just carry on. Sounds good.
Okay. So could you go to the next slide, please? Right. So patients were asked if they had to say thank you, who would they thank? And they were presented with a variety of options. The top three were nurses, doctors, and healthcare assistants. Next slide, please. And again, how patients were asked if they could improve any area within the NHS, what would it be? Presented with a variety of options there. What was key to them was communication and being treated with greater compassion. That was really important, which is what's vital to patients.
Yeah, as long as I can get up here and get him on the Tuesday.
Next slide, please.
Yeah.
And as mentioned before, if patients had to choose what they would improve about how they contribute to the NHS to improve it, what would it be? And only going to A&E is necessary. It kind of played a big part of that, alongside not missing any appointments. And that's kind of the high-level findings from the campaign, which we hope it contributed to the NHS Change Day initiative and provided some real insight to what patients think. Thank you.
Okay, great. Thanks, Ben. Okay, so thank you, both of our speakers. Does anybody have any questions from the live? Again, you just need to raise your virtual hand and we'll take you off mute so that you can ask a question. You can also write, if you have any questions, you can also write them in the chat box. Okay, so I'm going to ask my question first to Rachel. I know when you sent through some information to us earlier, I saw a video link that you had about the Patient First program. I thought that video was amazing. Actually, it kind of showed the journey of someone in your trust kind of trying on the older age suit and experiencing firsthand. I thought it was really quite powerful. Could you just talk a little bit about how you guys kind of thought about that pledge and how you kind of...
I just want to make sure she doesn't want me to do something.
Oh, hello. Sorry. I think that was Pip. Just not on mute. So Rachel, I would just thought you can, if you could just shed some more light on the experience of the person who put on this suit, and also maybe if you can just give the link out to the video so that other people on WebEx can look at that in their own time later.
Yeah, sure. Basically, it was the idea of Stacey, one of the events coordinator on my team, and she'd seen the age suit around and about, and she said, Sue said it would be great to understand what it's like from that kind of patient's perspective. So, so Sue basically, you know, got the suit. Sue's worked on the older people's team for around 15 years, and she's never done anything like that where she's actually kind of really tried to look at it from, you know, walk around and actually really experience things from the patient's viewpoint. And I think she found it quite profound. She really didn't realize that from pushing doors, how heavy they would be, pouring water, things that we probably so much take for granted, really impact on how other people, you know, can experience the hospital. In particular, you know, reading the letter and things like that. So we basically we had the idea, and Sue had made pledges around wanting to, you know, improve things for our older patients. So we thought who better to kind of really launch the program and to kind of try out wearing the suit. And we also hoped that it would help other people who watch Sue's experience of kind of wearing the suit really think about things differently and from a different viewpoint.
Yeah, I mean, I definitely agree. From my personal experience of viewing the video, you can clearly see that she was quite shocked by some of the simple things that I guess we would probably take for granted, like opening the door on the ward. I thought that was quite an interesting little snapshot in the video where it wasn't as easy as what we all thought it was. So I would highly recommend for people to take a look at that video link, and we'll make sure that we send out the video link soon. And okay, so thanks, Rachel. And then going over to Ben, very interesting about some of the data and the information that we got back from your survey as well. I was wondering if you've done a similar type of survey for other things, the same type of scale for other types of initiatives with Hospedia.
Yeah, absolutely. We work with a lot of hospitals across the country to utilise this real-time patient feedback system. So whether it's for the friends and family test or the national inpatient or smoking cessation services, all sorts of surveys we run on the bedside unit for various trusts where they're able to access patient feedback in real time and access patient is discharged. So any issue be rectified. It's a very effective way to react to patient needs. So absolutely, work with a lot of trust on that front.
Okay, great. So it looks like we still don't have any questions on the line. So I'm going to take it to Pip and to Rosanna to see if there's anything going on Twitter and in the chat box. So Pip, do you want to go first?
Hi, Nina. Thank you. Yes. People were obviously really impressed by Rachel's presentation and the whole notion of the old age student. One of the things that struck me was that it would be interesting to add blindfolds to the old age suite and see what it's like for people who are actually blind. So yeah, that seems to have made quite an impact. And I think, yeah, there hasn't been a huge amount on Twitter since I last spoke, but I think people are kind of beginning to identify themes, really, and pull together their ideas around dementia and elderly people, and a real need to improve the patient experience from the patient's perspective. So I think that's about all from Twitter at the moment.
Okay, great. Rosanna, is there anything in the chat box?
Well, I just sort of echo Pip's summary there, similar sort of chat going on with the web chat. There's a comment on Rachel's presentation that, you know, this is an excellent example of putting the patient first in action. And there's a real appreciation for, you know, these real ideas for improvements from patients' points of view. Andy has also just put a couple of notes up there if anybody wants to get hold of the poem by Owen Darnell. You can download that from Google, and has also posted a suggestion to look at Barbara's story, which is on YouTube, which was created by Guys and Thomas's Hospital, a very powerful 33-minute video. And that's it from the web chat for now.
Okay, great. I just noticed that we just got a comment from Emma about whether this information will be available online after today, and the answer is yes, it will be. We're kind of recording the entire WebEx, and we'll break it down into the sections that we've kind of been following today, and we'll post up all of those links on the Change Day website probably sometime next week. We'll send out an email when that happens as well. Okay, so does anyone have any... Sorry, go ahead, Rosanna.
Just wanted to say that Emma Lee has posted a few things before. She's deaf, so I'm going to respond to her in the web chat so that she knows about that.
Okay, great. Thank you. Okay, so if there's no more questions for this session, can we please give our two speakers a round of applause? And again, you can do that on the little bubble with a check mark in it. I'm going to do that right now myself. And we're going to take our next session is going to start at 11:40, and it's going to be the launch of a new white paper, which is going to be really exciting. So let's take a 10-minute break now, and we'll come back onto the WebEx at 11:40. So go grab a coffee, have a little bit of a bio break, and we'll speak to you shortly. Thank you.